PRP treatments that delivers long-lasting and life-changing results. Hello and welcome to Dr. Khan's Beauty Clinic. PRP, also called platelet-rich plasma, is an emerging therapeutic procedure in medicine for the treatment of facial rejuvenation, hair growth, and both acute and chronic soft tissue injuries. PRP therapy is an all-over facial treatment and as such is beneficial to many areas of the face. Below are some of the specific areas that PRP therapy targets: around the eyes, jawline, neck, cheeks, forehead, nasolabial folds, marionette lines. PRP is an extract of your own blood that contains 3 to 5 times more platelets, growth factors and active proteins for tissue and injury healing. It has been used medically for years to accelerate wound healing, repair tendons, ligaments and joint damage, heal diabetic ulcers and help regrow muscle and bone. When PRP is placed back into the skin by microneedling, it initiates a localized stem cell response. Over the weeks and months following treatment, the stem cell response recruits collagen-producing cells called fibroblasts. The fibroblasts replace tissue that has been damaged or lost through the aging process, with healthy skin that looks refreshed and rejuvenated. To get the maximum response, you should eat right, drink lots of water, and keep to the recommended skincare regime. Can everybody have PRP? Unfortunately not. Clients with abnormal platelet function, clotting disorders and chronic liver disease are not suitable for PRP therapy. Please do remember to disclose your relevant medical history with the doctor during your consultation. The treatment is suitable for all other people, regardless of age, gender or race. Does PRP therapy need pain relief? A light numbing cream is applied prior to treatment to make the process a lot more comfortable. Most clients will only experience mild discomfort, which is the result of the injections, and it is only temporary. Are there any risks with PRP therapy? Because you are using your own blood with no foreign substances, side effects are minimal. The injection process may cause some slight bruising, swelling and tenderness. As the platelets are the patient's own, there is no risk of transmissible diseases or allergic reactions. Infection risk is minimised by ensuring sterile technique and equipment. We recommend 3 to 4 treatments spaced 4 to 6 weeks apart, though the number and length between treatments could vary depending on your needs.